Hi, I'm Sue Friedman. I'm founder and executive director of BOAST, and it's such an honor and privilege to be able to present to you today. And today I will be talking about how to spot the BOAST, and I'll explain more about what that is, behind the cancer headlines. I want to start by saying that I have no disclosures or conflicts to report. So I'm going to start with just a bit of a definition. I want to talk about health literacy and give you the definition of health literacy. We often think of it as personal health literacy, and that is the degree that a person can find, understand, and use information and services related to health. So you can see from this definition that health literacy is not only about finding the information and understanding the information you're finding, but also using it. So health literacy and being health literate is an access to care issue too. And when we look at this graphic on the slide and we see this patient and their doctor, we might say that this patient has low health literacy. We often use health literacy as a label. We might say this patient has low health literacy because they're not really following the information that their doctor is providing them. But there's a new definition. I love this definition, and it's called organizational health literacy. And the definition of that is the degree to which organizations and the people within them, so the healthcare professionals, equitably help people find and use information and services related to health. And what I love about this definition is that it takes that sole responsibility off of the patient, off of the person, to be what we would call health literate. And it puts it on all of us, on society, on healthcare professionals, on organizations like BOAST that are developing health communications, to make sure that the information that we're providing is understandable to the people that we're providing that information to. So then if we take another look at this little graphic, we might look at it and say, well, maybe this healthcare professional or their system has low organizational health literacy because they're not explaining the information in a way that their patients can understand. So we're going to make this a little bit interactive, and you can see that we have just a quick poll and a QR code and a link here, and I'm going to drop the link in the chat. And if you can open up another window and open up this quick poll and just go to question 1, and I'll tell you when you can go to the next question. But we want to know, on a scale of 1 to 5, how would you rate your doctor or healthcare team's organizational health literacy? In other words, how good are they at communicating information to you in a way that you can understand and that it allows you to make good healthcare decisions and access that care? So we'll give you a minute to just tell us. 1 is very low, and then 2 is low, 3 is medium, 4 high, and 5 is very high. Just tell us how you would rate your doctor or healthcare team. I'll give you a second to answer that. So I'm going to give you one more definition, and that is digital health literacy. And it's a lot like the health literacy definition. It's really how well a person can find, understand, and use online or electronic information and services related to health. So it really just is like health literacy, but it takes into account some of the things that make online information a little bit harder for people to navigate. And we'll talk about that. I just want to say that there's a lot of things that affect health literacy. Health literacy is not one point in time, and there are many things beyond just education or whether you can understand statistics that affect how well people are able to find information, understand it, and use it. There's the personal situations. If someone has children at home and they're distracted, or maybe they need childcare to get to the doctor's office, those can all affect health literacy. Your access to, whether you've had training in technology, whether you, know how to surf the internet. Those things can affect your health literacy as well. Of course, your education. And then health literacy can be situational. So you can see this person on the left under situational. They look very calm. Maybe they just finished meditating. They may be in a good position to understand the information that's being provided versus this person on the right who may have just gotten bad information, scary information, may have just had a fight with a loved one, but they're obviously really upset, and that affects how well they can take that information and process it. So that's situational, and that can change, right, from minute to minute. So, if you're first diagnosed with a condition, oftentimes you get this fire hose of information. It's a lot of information coming through all at once, and it can be a lot to absorb, and that can affect your health literacy. And then the environment that you live in or where you're at. Are you far away from the closest healthcare system? Or, do you live in an urban environment? Do you have good transportation? And things like your support system. And whether you have access to, good internet service that's reliable. All of these things affect the information you get, how you find it, how you understand it, and your access to healthcare. So all of these things affect what we would call health literacy. So now I'm going to talk a little bit about some of those traps of online health information that make it particularly challenging to navigate. How many times have you seen this? Contradictory information, where two media outlets cover the same research, but they cover it very differently. So the article on the left is saying, that drinking milk doesn't really affect cancer risk. But the article on the right is talking about, how shocking it is that milk does increase cancer risk. And which is it? It's really easy to kind of throw up your hands and say, see, nobody knows. But there may be things that we can do to start to understand if one of these outlets may be reporting this scientific information more accurately than another. And information's extensive. I mean, you can do a search on your average search engine for colorectal cancer or breast cancer and end up with 159 million results in less than a second. I mean, in your lifetime, how are you supposed to sort through all of this? And it's not always that the most accurate information's at the top. And some of the search engines actually put advertisements at the top. So it's hard to distinguish what the more reliable sources of information are. And then information is often sensationalized, and perhaps you saw this headline saying that, these scientists in Israel were going to develop a cure for cancer, and they said they would be able to cure cancer in a year. And then 1 year later, because this was a few years ago, Forbes actually covered the story because this story got a lot of pickup. I mean, it was very sensational. A lot of very credible media outlets covered it and promoted the information. And then a year later, looking back, Forbes said, a year ago, Israeli researchers said they were going to cure cancer. Did they? Well, not surprisingly, no, they didn't. They didn't cure cancer. But when you're in the moment, and especially if you have a, critical health condition, oftentimes you're desperate for answers and for something positive, something to hold your hopes onto. So, articles like this can really sideline people, and some people will make medical decisions based on that. And oftentimes the information's not accurate. So you look at this article and it's talking about a blood test that's, meant to find cancer early. And it says, how it could reduce cancer deaths. But when you actually look at the research that was conducted, when you go to the actual research and the scientific report on that research, you can see that the research wasn't designed to show whether these tests could lower the risk of dying from cancer. They just weren't designed to tell you that answer. So, the media outlet really just kind of got ahead of themselves and reported this inaccurately. We'll see this a lot where the information's lacking expert review. And, you have to be careful of places, especially social media outlets where, people who share a condition may get together and, share the things that help them. And that can be a great thing, and really helpful to, share tips with other people. But sometimes unproven, treatments can be shared, and that can be dangerous. The other thing that we see a lot is celebrities promoting, new types of health options or saying what they did, and they get a lot of credibility because they're celebrities and people know them and they have a big following, but most of the time they're not medical experts in that area. And so be really careful about that too. And then the information that is credible is often full of jargon that's really hard to understand, with a lot of scientific words. And even if you do have a scientific background and you can understand it, oftentimes it's locked behind a paywall where you have to pay to get access to that information. And then we see this a lot where the information's out of context. It's just missing some important details that would really help you understand it. This was a story from several years ago where there was some research looking at Alzheimer's, and one of the media outlets was reporting Angelina Jolie gene may be linked to Alzheimer's. Well, that's not what the research was about. This was research in mice, and they were really trying to develop a new model to study Alzheimer's, but there was nothing about the research that was really designed to show a link between BRCA, inherited mutations and having Alzheimer's disease. And this was research in mice, but that wasn't really reported in the media well. So it's out of context and missing that information. And then there's something called confirmation bias. And, one of the ways that we often experience this is when we're looking for something, we're shopping for a red dress, and then suddenly we see all these ads for red dresses. And part of that is because of these internet platforms and the algorithms that they develop that feed us more information that we're looking for. So, for example, if you go on to, this is a made-up platform that we call MeTube, and just as it's a video platform like a lot of others. And if you look up 5G and you look at crystals, you see that there's all these videos saying how crystals can protect you from 5G radiation. And so the way that we're built, the way that we're designed to think, and this is just really all people, the more we see something, the more we tend to believe it's real. And so there's not just one video about a connection between crystals and 5G radiation and harm, but there's 76 of them. And so it can lead us to think, well, this isn't just one person saying it. And it may make information seem more credible, even when it's not. That's called confirmation bias. And this is actually a really good video on confirmation bias from Wired, where it says, how the internet tricks you into thinking you're always right. And again, it's because of those algorithms and you can see the article on the right says the same thing, that these biases in the algorithms really present us with information that we've already started looking for, and that can make us more likely to believe it's true, even if it's not. So we're going to go back to that poll and go to question 2. And we just like to hear from you guys. Has anyone sent you online health information about cancer that you found questionable, that you felt like, I better look this up and, do a little more research on this? And we'll give you just a minute to answer. So this brings me to a new resource that we developed at Force that you can find by going to facingourrisk.org/BOAST. And I'll talk a little bit about what BOAST means, but it's really a tool to help you figure out what is reliable health information and what may be unreliable, and looking for some of the red flags for misinformation online. And we're going to do this by, giving you some tips for looking at the source of the information, the content, so what's in it, and then how does this information relate to my situation? So what is the relevance of this research or media report to me and my situation? So we'll go over some tips for checking the source of the information. I'm going to talk a little bit about what's called the URL extension, and those are the letters that come after that dot, like www dot, and then there's usually the domain or the next few sets of letters, and then a .org, .com, .net, .info, .biz. Those are all URL extensions, and they can tell you a little bit about the, the source of the information. In general, .gov are websites that are, published by the United States government. They tend to be really well vetted. They get a lot of expert information, and they tend to be really, really reliable. .edu are usually academic institutions and colleges, and again, they tend to be pretty reliable. They really like to make sure that they're, promoting academic excellence. The one thing I would say is be cautious about press releases, because sometimes they don't get the same degree of oversight, and sometimes they can be very promotional. So sometimes institutions and colleges and, and other areas too that are producing press releases, some of those can be a bit sensationalized and a little bit biased, and we'll talk about that. Peer-reviewed journal articles are usually pretty, balanced and trustworthy, but oftentimes they're full of jargon and hard to understand. This is just an example, actually a made-up example, but very similar to other press releases that we've seen. They're coming with the logo for the institution, so that gives it credibility, and it was developed by them. But if it says news release or press release or for immediate release, just be careful that it may not be as balanced as we like to see information, especially medical information. Other URL extensions, .com, .net, .biz, these are usually for-profit businesses. There's nothing wrong with that, but it is worthwhile to take a deeper dive and try and get a better sense of who the business is, who runs it, who are their experts, who's on their staff. Just get a sense of what their business model is, so that you can get a sense of what their bias may be, or what, if they're trying to sell something. .org is for nonprofits like Force, and they tend to be reliable. But once again, it's really helpful to look at do they have a board of directors who's on it? Do they have a scientific advisory board? And who are the experts that they're turning to for information? And just get a better sense about, look at their mission, what they're trying to achieve. And that can tell you a lot about the source of the information and the quality of the information that they're sharing. And then social media posts, these tend to be, they're not always very reliable. Just really be careful when you're on social media about any claims that are being made. And, some things that you can do if you want to actually search for something. And remember, we did that search before, and we searched for colorectal cancer, and we got 159 million results in less than a second. But if you add the name of a trustworthy source to your search, it can narrow it down, and it may bring the more reliable information to the top. So if you add National Cancer Institution to colorectal cancer, then it narrows it down. Still a lot of results, but if you look at it, oftentimes it will give you in the highest order, toward the top, information that's coming directly from the National Cancer Institute, which is really a highly reliable source. Another great place to look for information, although it can be very technical and full of jargon, is a place called PubMed. This is a website that is produced by the National Library of Medicine. And much of the published research that is published in peer-reviewed journal articles can be found there. And they have something called the abstract, which is a little summary, not always in plain language, but you can see who else has done research on this topic. So it's a good place to start. So now we're going to switch gears and talk a little bit about checking the content. Just, some basic tips. Make sure that the information is based on research rather than one person's experience. And, watch for exaggerated language. There are just some words that may tell you this is not really balanced. Words like poison or scandal or magic or cure. These can be words that, are red flags that maybe this information isn't balanced information. So, again, talking about inflammatory language, remember these contradictory articles, one saying that, milk won't give you cancer, the other saying that it will. But maybe if we take a look at it, the article on the right says shocking scandal. So those are red flag words. I mean, they're very inflammatory. And so perhaps it tells us that maybe the article on the left is going to be a little bit more balanced. It really doesn't have those red flag words. It's not really exaggerating the information. So look for things that are balanced. And then tips for checking the relevance. So this can be a little bit harder, but the idea is, how much does this research that's coming out apply to me? Because oftentimes the media will cover research that's exciting, but it may be years away from being relevant, or it may be on a particular group of people whose situation is very different than yours. So it's worthwhile to take a deeper look at that. And so one of the things to ask yourself is this article about research? That's kind of the first thing. And it's important to read the entire media story if you can. I mean, some of them are long, but oftentimes, you have to go deeper into the article to get that context, to get that information that's going to tell you more about what that research was about. So is this even research? Was it an experiment that was done? Was it done on animals? Was it done on people? How many people? So just kind of ask yourself more questions about the science before taking it at face value. And then compare yourself to the people who were in the research study, if it was a study on people, and say, how much like you is their situation? Because the closer their situation was for the people in the study to your situation, then the more likely it is, not always, but the more likely it is to be relevant for you. And if the article is not about research, what is it about? Is this one person sharing their story? There's nothing wrong with one person sharing their stories. Stories can be really uplifting and helpful. It's always nice to hear that other people had good outcomes, but just be careful to make sure that, you recognize that one person's story does not necessarily represent everybody's outcome, and it's not the same as research. So just be cautious with that. It doesn't mean you should dismiss it, but just be cautious. So now we're going to talk about what the BOAST is. These are those kind of red flags, and a lot of it is stuff we've already covered, but BOAST stands for, so it's a simple way to kind of remember what those red flags are. Is it biased, overblown, amateur, sales focused, and then T is taken out of context or too soon to be useful. And we'll go through each of these a little bit. So bias, we all have a bias, but when you're looking at scientific research, it's important to see, is there a reason why this research may have a bias. So researchers and companies that are sponsoring research, they should disclose this. And when the media is covering the science, they should disclose any, conflicts of interest, any potential bias. Just because there's potential bias doesn't mean that the research isn't real, but it should just give you a little bit of pause to see, where is this researcher coming from? Watch for cherry picking. Cherry picking is where outlets or someone reporting on research may only report some of the findings that really support a belief that they may be trying to share with people. So they're not giving both sides of the story or all sides of the story, because research is not always one or the other side. Sometimes it's many perspectives. Overblown, we see that's a sensationalized, again, looking for those red flag words like magic or cure or scandal. I mean, that can indicate that this has been sensationalized. And we see that in the media because, the media likes people to click through information. And so oftentimes, especially in the headlines, they'll be really overblown. And sometimes when you read the article, it's more balanced. But, again, and that's why it's so important to read the entire article. A is amateur. And, again, that's about being careful about, where is this information coming from? Who said this? Who were these researchers? Are they researchers with expertise in this area? Or is this, is it a celebrity? They have a lot of followers, but maybe that doesn't mean they're experts. And even people with doctor after their name may not be experts in the field that's being talked about. So it's worthwhile, again, to do a little bit of a deeper dive. Remember that article from the Jerusalem Post where the scientists said that they were going to cure cancer in a year? Well, when we looked into the names of those scientists, they had never published in Cancer before. And so that could be a red flag that, perhaps these people don't have quite the expertise that they claim they do. And so, again, it's just another hint that this article may not be, the claims that they're making may not be accurate and may be overblown. Sales focus, it's okay if there are reports about, new science, new drug approvals, new ways to fight cancer that, are newsworthy. So that doesn't in and of itself make the information not credible, but be careful about reports that then are trying to sell you something within that context of this news finding. News should not be trying to sell you something. So look for that sales-focused pitch. Again, that could be another red flag. And then taken out of context or too early to be useful. We saw this example, and we see it a lot, where it may be really basic science research years away from, even being in studies for people. And so being careful to look for that. Look for whether the study was a study on people or, again, mice, because research on lab animals may be years away before it really can be applied to people. And so, too early to be useful and taken out of context, those two are really related. And sometimes that information may be in the media report, but you may have to read the entire story. So, try and read beyond just that first line. I know we like to, see things in small, small chunks of information that we can digest easily. But if you can, try and read the entire article, because oftentimes the media will say, who the scientists were, where the study was published, and provide more context about the research, but lower beyond the headline that was really sensational. And, here's an example about checking context. This article on the left, the media report on research article on the left that links coffee to better outcomes. And then, the article on the right, which is looking at asparagine, an amino acid, and cancer spread. Well, the research on the left was conducted in people. So if you read that media story and you read further, you would find out that this was actually a study in people. It's actually a really large study and a fairly well done study. So it might be more relevant than, when you read that article on the right. It's actually a study in mice. It's looking at a component of an amino acid that's a component in the diet, but it wasn't looking at, diets in people. So again, that can be a tip that the article on the left may be more relevant to decision making and to your health than the article on the right, which really was very early research on a component found in asparagus, but also many other foods, and especially vegetables. And this was another example, this article on honeybee venom. Well, it's too soon. This was really early research. They had just isolated this compound in honeybee venom. And it's cool because bees are cool and they're very photogenic, and it got covered by a lot of media outlets. But really, it was too soon to say that this chemical could be used for anything. I mean, they hadn't even made it into a drug yet, and they hadn't started researching it in people yet. So we're going to go to the last question. We're just going to do a quick knowledge test. And if you can go to that quiz again and just, take that third poll quiz. What kind of boast do you think this is? So this is an example. This is a doctor on MeTube. Actually, he's an actor on MeTube who played a doctor talking about his experience with cancer. Is this biased? Do you think it's overblown? Do you think it's amateur, sales focused, or taken out of context, or too soon to be useful? And which one do you think matches it best? Because there could be some overlap there. We'll give you a second to answer that. So I really appreciate your attention, and I hope you enjoyed this presentation. It's really meant to just really encourage you to start looking at information that you're seeing, especially online, and being really skeptical consumers of health information online and discerning. And so just some take-home messages. Champion health literacy for yourself and others. And that means also your healthcare professionals. If they're telling you information and you don't understand what they're telling you, ask them to explain it in plain language that you can understand. That's your right, to be presented information that you can understand, and you may be helping improve their organizational health literacy. Definitely talk to your healthcare professionals before acting on something you read online, even if it sounds like very promising. Take that information and share it with your healthcare professionals. And use and share our tips to spot the media boast. Thank you so much. I'm going to ask you, if you can, to give us a little bit more feedback. You'll notice there's a few more questions in that poll survey. If you could go and finish it, it shouldn't take more than 3 or 4 minutes, but it will really help us improve on this presentation. And really appreciate your time and your attention. And this is how you can connect with FORCE.